I'm Dr. Lora Shahine. I'm a reproductive endocrinologist at Pacific Northwest Fertility in Seattle, Washington, and clinical assistant professor at the University of Washington in the Department of Obstetrics and Gynecology. The journey to get to being a reproductive endocrinologist takes 4 years of college, 4 years of medical school, a 4-year residency program in obstetrics and gynecology, and then a subspecialty fellowship in reproductive endocrinology and infertility. That's 3 years. I went to college at Georgetown University in Washington, D.C. I did my medical school at Wake Forest University in North Carolina, residency in obstetrics and gynecology at the University of California at San Francisco, and my fellowship training at Stanford University. A reproductive endocrinologist is specialty trained in reproductive hormones and health, certain conditions like polycystic ovarian syndrome and endometriosis, but we spend the bulk of our training and learning about infertility and how to help people build families through low-tech treatment options like intrauterine insemination and high-tech treatment options like in vitro fertilization. My day-to-day as a reproductive endocrinologist in private practice is helping people build families, and it's a great mix of clinic consults and really talking to people, learning about their history, learning about their family goals, coming up with plans, to testing and some procedures, which I enjoy. Some evaluation procedures like hysterosalpingograms, some surgeries like hysteroscopies and egg retrievals. It's a really varied day, and I appreciate that. I'm passionate about my field. I enjoy helping people build their families. There is a real pull towards helping people at such a vulnerable time in their life, and it can be very rewarding. It's definitely a job of very high highs with success and getting birth announcements in the mail, to very low lows, like really helping people through miscarriages and failed fertility treatments. It is never a dull day. So advice for people that are interested in going into medicine, it really varies. I think it's important to gather experience and get to know other providers and medical professionals and understand that there's many different ways to help in the field of medicine. It doesn't have to be a doctor. There's wonderful options like being a nurse or a physician's assistant, radiology tech, phlebotomist, medical assistant, ultrasonographer. There's so many ways to help people in the field of medicine. Being a physician is not the only one, just happens to be the right path for me. My one piece of advice is really find a field that you're passionate about. Don't make a choice on a field of medicine or a path because you are considering the lifestyle, like choosing maybe dermatology because you feel like it's going to be a 9-to-5 job and you won't have to stay up late at night and be on call. If you are only choosing it for that reason and you are not really interested in the field, it's just not going to last. And finding something that you're passionate about, even if it means the training can be hard, if you're passionate about it, you can make it work for you later in life. So don't shy away from tough choices or tough paths, because if it's something that really interests you, it's not going to feel like work, and you're going to find a way to both have the life that you want to have, but also enjoy it along the way. I hope that helps.